Live on Facebook.
We are live.
So definitely lots of cursing and swearing. Okay.
Hola.
Here we go.
Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. Check us out. But I'm here today. I have Travis and Robert. So Travis and Robert are office managers at three of our facilities. Robert's all the way from Miami. What's up?
How's it going?
How's the weather here compared to Miami right now?
Actually, the weather here is pretty beautiful. Right now, it's pretty hot in Miami, so it's...
You ready to move up here then, or? Yeah, that's a no.
Yeah.
But anyways, Robert runs. We have a satellite clinic in Miami that does all the same things we do here in Columbus. So I want to bring these guys on today because they're in the trenches. They're actually seeing the patients even more so than I am at this point. So I want to talk to them a little bit about the stuff they're seeing and the people we're helping. And we're just doing some math here. The crazy thing, between the locations that Travis and Robert manage, we see about over 60,000 patient visits a year. So very busy facilities, helping people, changing lives. Really excited to talk to these guys today. So we're going to cut the break and we'll be right back.
Okay, real quick. Michael, can you do me a favor? Hand me that piece of paper that's over there, or Rachel, on top, that one that said, yeah, that right there. That whole thing stapled together. Thank you very kindly. I appreciate it. I set it over here last night before I left, and somebody else grabbed it and set it back over there.
That happens.
Not where it's supposed to be.
You own the station. Do something.
I own the station. I've only worked here 34 years. I don't own it yet. All right, here we go.
Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. I'm here today with Travis and Robert. And really want to focus today, guys, on the stuff you're seeing actually in the trenches. You know, I get on here and I talk about different things, and I can talk to myself for hours, so that's easy. But and I bring patients usually, but I wanted to bring you guys because you guys are actually seeing the patients. You're seeing what's going down in these facilities. And as I said earlier, Travis runs the Columbus operations in Gahanna and Grove City. You know, hormone replacement, weight loss, but this bioidentical hormone replacement therapy. And Robert runs the satellite clinic we have in Miami. So let's talk a little bit. So what kind of stuff do you see? Like, what's the most common patient we see? Would you say, Trav?
Yeah, a patient that has came in and they've been feeling, depressed, or whether it's weight gain, inflammation, and a lot of times they've maybe heard a little bit about hormone replacement therapy, or a little bit about medical weight loss. And they come in, and we got to debunkify some of the myths, right, that they've heard, and they classify bioidenticals with synthetics.
And one thing I do want to be clear on this, and I know it's the same way in Miami. If you guys are listening to the show, we don't charge you to come in and talk to you. Like, it's not like a regular doctor's office where you got to pay your copay and like, come check us out. Like, you come in, it doesn't cost anything to educate yourself. And I always tell people, come educate yourself and then make a decision. There's no pressure. But I think a lot of people think, oh man, I go to the doctor's office, I'm going to pay pay whatever money, and there's going to be all this pressure. It doesn't work that way. No. It doesn't work that way. The way we do things is really different, and we want to serve our patients. And the best way to serve them is to educate them, and then they got to make their own decisions.
Absolutely.
So I don't want you to think, when you listen to the show here, I know a lot of people listen to the show and they don't take that step of coming in. You have nothing to lose. No. Whether you're interested in stem cells or hormone replacement or weight loss, there's no pressure.
I always tell people the information is free. Just come here, get the information, and then make a educated.
Then make a decision on your own, right? I mean, and it's not for everybody. And if it's not for you, that's fine. But at least you've educated yourself.
Absolutely.
Okay, so sorry, Travis, I cut you off. But, okay.
No, you're more than fine. So they'll come in and we'll debunkify some of the myths. We have to understand that, insurance companies, they have minimum of 1,300 lobbyists, that are out there putting blogs, and it makes it very confusing to navigate, your own way in health. So they'll come in, and instantly we let them know we're there to serve, just as you said. Literally, you can tell when you sit down with us, when you come in, we're excited to talk to you. We know that you're going to hear a lot of this stuff for the first time, and that's exciting on our end of the desk, So first thing, we put them at ease and let them know we're there to serve them, no matter what they're dealing with. If they have sexual dysfunction because of their testosterone is extremely low, or if they've been putting on weight that they've never had before, we let them know we're there to love on them, and we want to serve them. And the coolest thing, that's kind of a segue, is there's zero pressure into getting your blood work done. People lie, but blood work doesn't. And there's a lot of people out there that have been put on a synthetic hormone which cause side effects, and again, bioidenticals don't, because they're identical to what your body produces.
Yeah, and I want to clarify something too, because I hear this all the time when I do lectures. I'll be approached by people and they'll say, well, I'm on hormones, but how do I know, doc, if they're bioidentical? And there's a really easy, cool way to tell. If you're on hormones and it has a warning label, it's not bioidentical.
Yes.
Because bioidenticals don't have a warning label. You see what I'm saying? So if your doctor has you on what they say is a hormone, but there's a warning label with them, and usually it's on that parchment paper. It's good to start fires with that stuff. But if it has parchment paper, it's not bioidentical. Because drugs are synthetic and they have to have warning labels. And usually the warning label and all the contraindications or things that are bad for you are way longer than what's good for you.
Absolutely.
Okay, so anything we prescribe in our office, there's no warning labels. There's nothing we prescribe. So that's a huge difference.
Yep. So a lot of these people will come in and one of the first things I'll ask them if they've been on synthetics. I'll say, did your doctor do blood work before he puts you on a synthetic hormone that he's saying you need? Almost every single time, no. The answer is no. And you want to say, well, and again, it's not that the doctor has a sinister intent, but, the continuing education courses are put on by pharmaceutical companies, which...
Yeah, people don't realize as a doctor, the only education you get, and actually most education you get in medical school at this point is run by the pharmaceutical companies. They sponsor the different branches of the hospital. But it is what it is.
Yes.
But pretty much the majority of education that medical providers are going to get once they graduate medical school is put on by pharmaceutical companies.
Yes.
So, and obviously, they're usually at nice country clubs or beach places, and you go there and you bring your family, and it's all, it's all catered and covered. But obviously, they're going to talk about their drugs.
Yep.
You know what I'm saying? So it's not that your doctor means bad, but it's if you're fed the same garbage every day and that's all you hear about, then that's kind of what you end up doing.
Yeah, they're operating under the only system they've ever been taught. So
Right.
No sinister intent there. So your doctor who doesn't specialize in this treatment as we do, it's not his fault. He's trying to help, or he or she. And I want to let them know that, well, if he thought you might have been deficient in that hormone, they could have tested that. And they could have found that out before they put you on the hormone. So for one of the first things we do, as we all know, we run the blood work. We let them know this may not be for you, but the cool thing is we're going to be able to tell. You're going to come back and we're going to review you. We're going to review who you are because we can see it now, and we're going to operate under that because we're willing to put our neck on the line for what we believe in. You can come back in a month. We're going to retest that blood, and you'll see your improvement rather than the blind shots in the dark that these prescriptions, are putting you in.
It's one thing to feel the improvements subjectively. Yeah, I'm feeling better. Yeah, my energy has improved. But it's another thing when you can track it through blood work. You are objectively seeing the signs of improvement. Seeing your hormone levels to an optimal level, seeing the testosterone levels, reach that 700, 900 range, or seeing the estrogen under well control. The biggest thing I see is we have patients come in all the time, thinking I've been on. They say I've been on hormones for 5 years now. We do their blood work and they're more jacked up than a lot of the patients who've never even dabbled in it before. So it's a great thing to be able to not only help people who've never been educated on hormones, but to help the people that have been doing it the wrong way for so many years. And to me, that's the important thing.
I can't tell you how many people have come to us that have been treating with endocrinologists or urologists for hormones, and they're just a mess.
Yeah.
And what you have to understand is, if they don't have specialized training in anti-aging and bioidentical hormone replacement therapy, which you're not going to get in school or college,
Sure.
It's Russian roulette. And we've fixed a lot of people that have been treating with urologists and endocrinologists, but I strongly, strongly disagree with the way they're treated. And their levels come in, they're too high, they're too low, they're not managing their estrogen, they're not on bioidenticals.
Hemoglobin levels are through the roof.
Yeah. All these bad things that these other physicians don't even check for.
Absolutely. Because
they just don't specialize in it. And I've said this multiple times on the show. A regular urologist, endocrinologist, or family practice, they're not set up to manage a hormone patient. There's a high level of supervision. You have to get blood works done. You have to review the blood works. It's not as simple as here's your prescription, have a nice life. You know what I'm saying? There's lots of oversight on these cases. And there's lots of specialized training to do bioidenticals properly, and that's what we specialize in Miami here, and no one does it as good as us. I haven't seen no one locally does it like we do.
That's a fact.
But that requires a lot of work on our side. We have a full team of people there. There's so much backside work that people don't see. But that's what there's no side effects to taking bioidentical hormones, but you can overdose and you can underdose. Okay, so and that's where that management comes in. So as long as you don't overdose and underdose, and it's done properly, it's a life changer. But when done improperly, I mean, I tell you, if you don't have to do it properly, just don't do it.
Exactly.
And the blood work doesn't lie. And I think Travis has said it before. Any doctor who's willing to manage your case via blood work, there's no way the blood work never lies, right?
Never.
You know, so we're putting our neck on the line, because if we don't fix your blood work like we promised, then we don't uphold our side of the deal.
Yeah,
right?
and then we're liars.
You know, we go over your blood work every single time with you, and everyone knows you're going to feel better, right? But that's a side effect of being better and being healthier. But the blood work is confirmation of this. You're going to see your blood work change.
Yep.
And what kind of changes do you guys see? Like,
all kinds. Even, I mean, the strongest testimonies are, you know, the strongest reflections are testimonies. And me personally, myself, being on the treatment for close to 4 years now, it's a complete life change. And Buzz, you know me, that I'm very big on connecting, you know, the body shape to the mind, and the body follows the mind and vice versa. And the guy that you're hearing talk, like, I didn't always talk like this. You know, at one point, 338 pounds, depressed, 19 years old. You know, my brain has been patterned in could think a certain way at that point that I'm thankful I don't think anymore. And something I wanted to tell you guys is, whatever you're feeling, whatever your ailment is that's leading to a weak mindset. So if your back has been hurting forever because you have so much inflammation and not enough hormones to battle, and it's leading to you to becoming depressed. Or if you cannot stop gaining weight, all of a sudden at 35 years old and you never had this issue and you're embarrassed to go out anymore. Or if you get home from work and you feel like sitting on the couch and don't have any energy to pour into your family. I wanted you to know that we see people that feel like that each and every single day. But the most fulfillment
every day.
Every day.
Like, yeah, this is not, you're not alone.
I will tell you right now, Buzz, sitting down with 15 people in a day, new patients, I will tell you at least 2 to 3 will tear up. Both men and women.
And what's been surprisingly enough is, you know, people come in, you know, typically they have the whole stigma of hormones. I want to get big, I want to get stronger. And I always tell people that, yeah, that's great. That's going to happen. That is a side effect. You're going to be able, you know, your muscle building capabilities definitely improves as hormones become optimal. But the biggest surprise is your cognitive improvement. You know, it's the mental sharpness. It's the, you know, their ability to focus, their their mental energy, so they can last throughout the whole day at top speed, pretty much. So that's, to me,
that's huge. A lot of people just think they're just, I mean, how many people just, like, you know, you talk about Travis, some people label themselves. I'm a fat person.
Yes.
I'm older.
Yes.
You know.
One of the saddest things I've seen is people getting older. They'll come in like it's a rite of passage. Like, well, I'm just getting older. And shouldn't you have, you know, less hormones? And I say, absolutely not. Because you have just as many, you know, inflammatory processes, well, more inflammatory processes building in your body that need battled against. You need these hormones now more than ever. Buzz, you said it, people with heart problems will come in and say, you know, I'm not sure, I've had some heart issues. I don't know if I should get on testosterone. You say, you need to get on this now. You know, this is...
If you have a weak heart, you know, what they call it, if you have a weak heart, heart's a muscle.
Yes.
So we all know that hormones make your muscles stronger. So it's, I mean, you don't have to be a doctor to figure this out. Yeah. It's very logical that hormones would help a weak heart.
Yeah,
right? I mean,
absolutely.
And that's another thing. That's the biggest difference with us. You know, we're not just looking at testosterone level. We're looking at all the other key hormones, such as IGF, which plays a huge part in the health of your connective tissues. And like you were saying, the heart is all connective tissue. So if you can improve
growth hormone. There's a direct correlation.
Yep.
I always tell you the cool thing about when I do lectures or on the radio, you can fact check this, Google anything I talk about, and you'll see it. There's a direct correlation to decreased growth hormone levels in heart disease.
Absolutely.
Direct correlation.
Absolutely. But
But that's very logical, because growth hormone, it has a lot to do with connective tissue strength. Your heart is made up of muscle and connective tissue. So what most people die, you know, heart disease is the number one killer of people, right? And what happens, the majority of heart disease is, what happens over time, your heart gets too big. It stretches out. And when it stretches out, it becomes less effective. It's kind of like if you have a balloon and you blow up a balloon. When you first blow a balloon up, it's really hard to blow, but because it has a lot of restriction, it blows back on you.
Yeah.
But over time, there's less constriction because it stretches out.
Yeah.
It's the one muscle you don't want to get bigger.
Yeah. So, but what happens as it has less force against it, it doesn't provide circulation to the extremities. And that's how you end up with peripheral neuropathies and all, you know, and think your brain is as far as you can get from your heart too. So affects brain function, affects all these other things. So obviously, keeping your growth hormone levels optimal and your hormone levels optimal has a lot to do with this. And this is fact. It's not just me making stuff up. This is the way it is. You know, and one of our favorite things, or one of the things that people love the most at our facilities, is the growth hormone boosters we use.
Yep.
Yes.
I mean,
And that plays a huge role in your mood and your attitude. There is also a very strong correlation between IGF levels and the quality of sleep you get, and how deep of sleep you get. And that's your body's way of regenerating. That's your body's way of healing itself after going through, the hustle from throughout the day. And just being able to optimize those IGF levels make a huge difference in patients suffering from depression, suffering from any other, type of mental fatigue or, stuff like that. So it's great stuff.
We talk about that all the time too. Depression is so often misdiagnosed.
Yep.
Absolutely.
You know, the symptoms of depression, symptoms of hormone imbalances, they're identical. They're mirror images.
Yep.
Depression, lack of libido, no motivation,
Anxiety.
They're mirror images. And kind of going back to managing a hormone patient is a lot of work. A general practitioner, in the way insurance companies are set up these days, they're not set up to do that. They just can't. They're not able to. So what happens? You go to your doctor and you say, "Hey, I'm depressed. I don't have energy. I'm just not motivated. Could it be my hormones?" And it happens all the time. Well, let's start you on this. It sounds like it could be depression too. Let's put you on this antidepressant, which makes it worse, right? Which makes it worse because that causes more of the lethargy and all the stuff that you don't want.
Anti-anxiety on top of that, just to deal with the anxiety of being depressed, and then it just snowballs from there.
Yeah, it's terrible. And I always tell people that antidepressants are designed for short-term use only. They were never intended to be something you take for the rest of your life.
Yep.
And the majority of people who get on antidepressants just never get off. And that's sad because now you're messing with brain chemistry.
Yes.
And anytime you're messing with brain chemistry, are they going to find out that that's leading to Parkinson's disease or Alzheimer's disease? Who knows? I mean, we're finding out, like they said, statins are now related to Parkinson's disease. Well,
yeah.
What about the people who've been on statins for 20 years? How does that make you feel? Like,
Exactly.
they're really going to
People don't realize cholesterol actually is a neurotransmitter protecting. So if you're synthetically trying to lower your cholesterol to a ideal range, whatever that may be determined by the medical institution, it's opening yourself up to all these other
You'll never find somebody on a statin who feels good. Never.
Yep.
When someone goes on a statin, they feel terrible because cholesterol is the building block of your hormonal system. So what happens to a lot of people as your hormones decrease with age, your body naturally produces more cholesterol because cholesterol turns into hormones. That's a natural response. So you go to your doctor and they test your cholesterol. Most doctors don't even check your hormones, right? That's not part of a normal blood panel. But they do test cholesterol.
Yep.
And they'll say, hey, your cholesterol's high. Well, probably because your testosterone is low.
Yes.
So we need to get that down, so let's put you on the statin to block the cholesterol. Well, number one, that even takes your hormones down more so. So most people on statins, almost everyone has joint pain, aches and pains, and they sleep terrible because you get rid of the testosterone, you have more inflammation, it decreases growth hormones, you're not able to sleep, you're not able to heal. It's this vicious cycle. It's this vicious cycle. And once again, I'm going to go back to get your blood work done.
Get your blood work
If you don't feel right, and when I say get your blood work done, that doesn't mean you go to your doctor and get a CBC and a metabolic panel that tells you nothing about hormones. Go to someone who does anti-aging if you plan on living a long time and want to stay young the rest of your life. Get a full panel done. Check your growth hormone levels. Check your testosterone. Check your estrogen, progesterone. These things that make you feel young and vibrant. And if they're decreased, replace them. It's that simple.
Yep.
And if you don't need the help, but it's not your time then, perfect.
I always tell people that, I get approached all the time. Hey, doc, I think I need to get on testosterone. I said, listen, just do blood work because if you don't need it, we're not messing with it.
Yeah.
You know what I'm saying? There'll be time. Eventually, everyone's going to need it. But if you come to us and your levels are fine, if it's not broke, you don't fix it. Right?
We're not going to lie so you become a patient,
Well, they're going to see the blood work.
Yeah, and
it's not like
Amen.
we show them the blood work. If it's not a non-issue, I mean, there's people who come every week that we don't do anything with.
For sure.
Yeah.
Absolutely.
And
they're
that's
happy, and at least they know them now. They know they didn't talk to, it's not a blind shot in the dark.
There's a person that came in yesterday, I think, she was vitamin D deficient. She didn't need hormones, she needed vitamin D.
That's simple.
It's simple. I mean, vitamin D is what that costs, 10 cents a day? Like, I don't know, whatever. It's like, so it's not about money for us, it's about helping and serving.
Yeah. Literally, when a patient will bring in a medication they're on, I'll say, what all is this for? And I'll literally get the answer, I don't know. I'm not exactly sure.
And that's almost scary because they're blindly trusting somebody prescribing them these drugs that are affecting them in ways that they don't even understand.
Amen. So because they're blindly trusting, Robert, they have zero certainty in their care. And I don't care what type of patient you are. If you don't have any belief or any type of certainty delivered in your care, it's not going to work. For instance, weight loss program, it's medically impossible for it not to work. But if somebody were to come in and say, "Oh, this isn't going to work. This isn't going to work. This isn't going to work," they're subconsciously going to find ways for it to not to work in any plan. So,
Yep.
and what I was, as far as what we see in the office with these patients that do come in, with, whether they've been out of work again because of the inflammation, they're gaining an immense amount of weight, or they have zero energy. It's always leading to them becoming depressed or sad about themselves or losing confidence in some way or another. And that's why when we tell them, when they move forward with us, it is an investment, because they're going to get so much back, right? And people over.
Yeah, you always say there's a big difference between
an investment versus cost.
Yeah, what's the difference?
Well, that medication costed you. That costed you took the time away from your family, your loved ones, to go time away from work, to go and sit down, fill out that paperwork, sit in front of a doctor that didn't even run your blood work, and is giving you prescription meds without fully even explaining what this is doing for you. And that is costing you, because you're not getting anything back but more meds the next time you go, and another copay, another deductible, whatever that is. With us, you're going to invest, but if you invest in us, you're going to be a new being in 5 years. And I can say that personally, and that's what I was talking about. When we come in and we reverse the symptoms of the inflammation so you can get back to work, when we get the weight off of you so you can be confident to feel like going out with your girlfriends again, or you can feel confident around your wife, whatever that is, that's going to lead to you being a better husband. That's going to make your smile a little bit bigger when you wake up in the morning. It's going to make you a little, walk a little bit taller when you're walking. And
yeah, and it motivates you to become a better person overall. Improve your sleep, improve your diet, improve your water intake, stuff that you never even thought of before.
Amen.
But as you improve your hormones, as you get this feeling of regeneration, it's pretty euphoric, and you just want to keep it going. So you just keep looking for other ways to improve your body.
yes,
So it's amazing.
I love it. They say the key to happiness is progress. Well, come into Buckeye, not only will you get progress, we're going to track it, and we're going to show you your progress via blood work or the scale.
Yeah, what really the difference would be the way we manage patients is we manage them subjectively, and what subjective means, I have a symptom, I'm tired, I don't sleep well. That's subjective, So, but we also do it objectively with blood work. So not only will you notice a difference, but you'll literally see it on paper. It's real.
Yes.
You know what I'm saying? There's no wish-wash or whatever, it's right there. So, and obviously, if you can make your blood work look like a 25-year-old and you're 55 or 60,
Yes.
guess how you're going to feel?
A lot more like a 25-year-old rather than a 60-year-old.
Yeah. Who doesn't want that?
Exactly. Absolutely. That's really one of the big things is, in all of our programs too, regenerative medicine. We're tracking your care. Well, we're also going to run blood work, and we're going to see if you have a sufficient amount of testosterone to make sure you're fighting the inflammation, or make sure you have a sufficient amount of estrogen in women to make sure we're revalidating that bone density. Whatever that is, weight loss. We're going to see if
Nitric acid levels. If people come in with high blood pressure all the time. Like, well, we know nitric oxide is what causes your blood vessels to open up. So instead of taking a blood pressure medication, why don't we go back to the basics? Does your body produce nitric acid or nitric oxide? And if it doesn't, instead of taking a drug,
Yep.
you can take a supplement that there's no side effects to open the blood vessels up. It's natural, it's safe, it's less expensive than a blood pressure medication, and it fixes the problem.
Yep.
Much better than taking a blood pressure medication. That doesn't even make sense. The pharmaceutical companies have enough money. We don't want to give them any more money. If we can do something natural and safe, that makes total sense.
Without question. I think it was off type 2 diabetes alone. They're making $200 billion a year off medications, and that's a reversible.
Type 2 diabetes is totally reversible.
100%.
So anyone who's type 2 diabetic can become clinically non-diabetic with the proper diet and supplementation. Every single person.
So big
type
pharma.
1, no, but type 2, yes.
Yep. So big pharma is making $200 billion a year. They're estimating that in 2020, that is going to double plus $100 million. That's going $500 million a year. They're making off type 2 diabetic medications, and that's why the prescriptions keep increasing, and the patient knowledge keeps decreasing, and that's why we want to keep giving you guys a voice and another option and track your progress rather than getting blind shots in the dark.
Absolutely. Knowledge is power, and the more knowledge you have about a subject, the better educated decisions you can make, and the better it's for you in the long run. And that's what it's all about. At the end of the day, it's helping you become a better you. Both inside and out, physically, hormonally, mentally, all that. So it's And one thing I wanted to touch up with too, Travis, is you had mentioned the regenerative cell therapy, and that's such an organic fit between HRT and regenerative cell therapy with stem cells, because they just feed off each other.
Amen.
You know? And you know, regenerative cell therapy, including stem cell therapies, you know, from umbilical cord, core site, which is actually regrowing tissue. But if you can control the inflammation with your hormones, it just enhances, and it's made such a big difference in patients' results when they get a procedure like that done. So.
Yeah, and you know, myself, Dr. Bannon, and the clinical director in Florida, Dr. Gambardella, we're all fellowship trained in stem cells, which is the highest level of education you can have. It's a year-long process. In Ohio, we're the only ones here. I don't know if anyone else is down in Miami. In Ohio, myself and Dr. Bannon, who we work together, we're a team. We're the only physicians in the state that have fellowship training. So more people are dabbling in stem cells and what they say stem cells. But I mean, if you're thinking that you want to do a stem cell procedure, I mean, it doesn't make sense to go someone who has no formal education in it.
No.
And I mean, just because you can do it doesn't mean you've been trained in it.
So true.
So, and the results we see with that are amazing. What kind of stuff have you seen, Robert?
I mean, we've given people back their life. I mean, we've had people come in, you know, scheduled for a total knee replacement, and they're coming in as their last-ditch effort. They found us, you know, on Facebook or wherever, and they're just coming in for that last hope, just that last try before they cut open their knee. And you know, they ended up deciding to do the procedure with us, and it's changed their life. People who, I can give you one example. He's a veteran. He you know, loved riding bike, and you know, because of he had you know, his knee issues, degeneration for years and years. He no longer could ride that, and I think it was maybe 6 months after him completing the procedure, he just completed a 35-mile bike ride for cancer.
That's
patients.
awesome.
So yeah,
Awesome.
and again, it's just passing it on, you know, helping people so they can help others, you know, and that's definitely a great feeling.
Pouring into yourself so you can pour more out into others.
That's right.
So that's why, you know, with us, you're investing.
Yeah.
And I promise you, invest in yourself. Your kids are going to be happier. I mean, everyone around you. Your state and how you feel will affect those around you, whether you want it to or not.
Awesome. Well, guys, thanks so much. We got to get off here. They're giving us the mean mode. Jim is over here.
607 614 607 2480. Give us a call.
Awesome. Robert, Travis, thanks so much for being on here today.
Pleasure. Thank you for having me.
This is Dr. Buzz with Buckeye Physical Medicine and Rehab, BuckeyePMR.com's website. Check us out. Cool.
And I stopped taking my statins when I started the testosterone therapy.
Oh.
When I heard you talk about that, because my doctor said, hey, you have high cholesterol, take these statins.
Fucking worst.
And then when I heard you